Hi everyone, the National Headache Foundation wants to welcome you to tonight's webinar, Physical Therapy for Headache, with Denise Schneider. Denise Schneider is a physical therapist in the Chicagoland area. She is dedicated to providing the utmost patient experience by incorporating evidence-based practice and individualized care to include all aspects of one's health and well-being. Her clinical interests include spine, headache, chronic pain, vestibular, concussion, and manual therapy. And with that, I'll let her begin the presentation.
Thank you. So thank you all for attending tonight. Like Eric said, I'm a physical therapist. I have been practicing for over 16 years. However, I've been treating headache patients for about the past 10 years now. And, oh, let me just trying to forward the slide. Okay, sorry about that, little technical difficulty. So in addition to the headache physician, there are a lot of healthcare providers that make up the team when treating a person with a headache, and physical therapist is definitely one of them. So I wanted to talk to you a little bit about what physical therapy is and what a physical therapist actually does, so that this will help to clarify why physical therapy is used. So physical therapy is the application of techniques and strategies by a licensed physical therapist for the purpose of restoring function and promoting optimal physical function. And a physical therapist does many things, including listed below. So we diagnose and treat health and medical problems that result in restrictions in movement and function. We do an examination to assess these restrictions, and then based on this examination, we'll develop individualized treatment programs which will help to increase movement, decrease pain, restore function, improve health and wellness, and improve overall quality of life. So we truly collaborate with other healthcare professionals too to make sure the patient gets the utmost comprehensive individualized care. Physical therapy is a successful part of the treatment plan for certain types of headache. And it has been shown to decrease or resolve the intensity and frequency of headache. It decreases the duration of headache, can decrease the use of medication. It can improve a headache sufferer's function and mobility, and again, overall improve quality of life. So this picture shows this person has a cervicogenic headache, which is basically a type of headache that starts in the neck and radiates from there. And this is the type of headache that I'm going to focus on today because it responds very well to physical therapy. So there is diagnostic criteria to define the cervicogenic headache, and it's listed here. So typically, and a patient does have a cervical spine issue, so that's why it's called a cervicogenic headache. And the headache has two of the following. It's developed in relation to the cervical spine problem. It gets better or decreases with resolution of the cervical spine problem. A patient usually has a limited range of motion, so decreased movement of the head or neck. And also the patient may have a decrease in symptoms with an injection to part of the cervical spine or the nerve. So people that do have these cervicogenic headaches often have other symptoms listed here. So patients have neck pain, stiffness, tenderness, shoulder pain. They can have weakness, dizziness, and mild nausea. The location of this type of headache, so it starts usually in the back of the head and radiates from there. It can be on one side or the other, but typically does not switch back and forth. It can be just in the back of the head, just in the side of the head, or the ram's horn distribution, which is back of the head up to the top of the head and into the eye. And so it's important to note the location because this is different from, say, like a migraine headache, which usually starts in the front and radiates from there. And this type of headache is due to musculoskeletal involvement of the cervical spine, which includes involvement of bones, joints, muscles, and ligaments. So you can have joint stiffness of the spine. You can have muscle impairments such as decreased strength and endurance of spine muscles, also shoulder blade muscles, Patient may have soft tissue restrictions. So the MTP stands for myofascial trigger point. That's tight bands in the muscle. Patients might also have decreased flexibility of their head and neck. And this type of headache, important to note, you don't have to have an injury for this type of headache to occur. It can result from trauma or non-trauma. So it can be due to, say, if you are in a prolonged posture, like sitting for a long period of time, or if you have a job where you do a repetitive type of motion or have to look up or to the side. So it can be due to different types of things. So as you can see, the physical therapy for this type of headache is highly recommended due to the musculoskeletal involvement, which is what physical therapists deal with on a daily basis. And if you have not had physical therapy before, it can really be scary or intimidating, especially when you're in pain and you're not feeling well. So in the next slides, I'm going to talk to you about what you can expect if you do go to physical therapy for this. So your first day will ask you a ton of questions. So it consists of the patient interview and also the objective exam. But we do ask a ton of questions so that we can figure out what type of headache you have, or if you have something else that may be contributing to your symptoms. And all of this information that we get from day one is going to be absolutely necessary when we formulate your treatment plan. So on day one, we'll ask you about the location of your pain. For example, where does it start? Where does it end? So if it starts in the back of your head and goes forward, that's going to be important to note versus if it starts in the front of your head and radiates backward. So we'll also ask you about when does your pain occur? Does it occur if you look a certain direction, if you sit for a certain amount of time? What are you doing when your pain happens? Or are you not doing anything when you have your headache? And then we want to know the type of pain that you have. Is it dull, aching, throbbing? Is it the worst pain you've ever felt in your life? And all of these answers will clue us into what type of headache you may have. We'll also ask you what makes it worse or what are your triggers. So there can be many different triggers. It could be a certain position again or a range of motion. It can be, does light or sound aggravate your headache? And what about food, alcohol, odor, sleep, weather, stress, caffeine, hormones, eye strain, anything. And going along with that, not only do we want to know what makes it worse, we want to know what makes it better. Does a certain position again make it better, or a certain range of motion? Does medication make it better? And then we'll also ask what other types of symptoms you have. So do you have dizziness, nausea, weakness, neck pain, even loss of balance? Any other symptom that may be accompanying your headache? And then is there anything else, such as, if you did have a trauma, were you in a car accident, what happened? Also, do you have a family history of headache? Did you have any tests? Did the doctor do tests such as X-ray, MRI? We'll ask you questions like, do you sleep regularly? Do you eat regularly? Do you keep a headache diary? So definitely a ton of questions so that we can get to the bottom of what's going on with your headache in order to formulate our treatment plan. So after we ask you a bunch of questions, then we'll take a look at a bunch of different things. So first, we'll assess your posture. What's the position of your head and your shoulders on your neck? Do you hold your head in a certain position and whatnot? So we're looking for to see if there's any asymmetries or abnormalities with your posture or the position of your head on your shoulders. And then we'll check your range of motion. So how do you move your head and your neck? We want to look to see if there's a limit in the range of motion, but also does the range of motion reproduce your symptoms or cause any other type of symptoms? We also may check your shoulder range of motion because a limit in the range of motion of your shoulders can affect your head and your neck. And then next, what we're going to do is check the joint mobility of your cervical spine. So this includes the manual assessment of the cervical spine and mobility at each individual segment. There's 7 cervical vertebrae that make up the joints, which we're going to test. And the purpose of this is to assess for stiffness. And if you have stiffness in certain joints, that can contribute to your headache or exacerbate symptoms of headache. So we'll also apply pressure to the joints to assess for pain provocation. Does it reproduce your symptoms? And this is another indication that the headache might be caused by the cervical spine structures. So these pictures are just certain tests that we might be doing in the clinic. And after we take a look at all of that, then we'll assess your strength and endurance. So there's little muscles that actually attach to your neck and your cervical spine that have been shown to be weak with patients that have cervicogenic headache. So we want to test those muscles. Also, we'll test your upper extremities and your scapular muscles. These are your shoulder blade muscles, because imbalances here too can contribute to headache or again exacerbate headache. And the combination of the limited cervical movement, upper cervical joint stiffness, and decreased strength of the neck flexors equal a high probability that your headache is cervicogenic in nature. So after we look at the muscles, we're going to assess the soft tissues. So we'll feel the muscles to check for trigger points in the muscles of the head, neck, and shoulders. We'll also assess the flexibility of the muscles, because also if you have a limit here in the flexibility, or if you have trigger points, those can reproduce your headache pain. Okay, and then I put other tests too, because when you do come for your physical therapy exam, there's a lot of other things that we test, such as strength of other muscles, reflexes, and whatnot. But for the sake of time, I mentioned the tests that are specific to cervicogenic headache. Okay, so our treatment, our physical therapy treatment, we definitely need to do a thorough examination in order to provide the best, most accurate treatment. Typically, physical therapy treatment will consist of manual therapy and exercise. So manual therapy is when the therapist actually places their hands on your head and your neck. Sessions usually last up to an hour, and patients can come in anywhere between 1 to 3 times a week, as little as 4 to 6 visits, but can also be up to about 12 visits, really depending on what the patient's deficits are. And typically the visits are done within a 1 to 2 month period. But again, this all varies depending on the patient's deficits, and also if patients have overlapping headaches or other issues and medical conditions that might affect their recovery. Okay, so as far as treatment, the manual therapy that we do is hands-on, very hands-on, specific and individualized to the patient. So we'll do joint mobilization. So this is when the physical therapist moves joint surfaces in certain directions with a certain amount of force. And these are shown in the pictures below, but these can be performed in any position, such as sitting or laying down. These techniques can be specific to certain joints. So the first 2 pictures show local segmental techniques versus the third picture, which shows more of a general technique, which is called a suboccipital release or cervical spine axial separation. So it's just a general technique. But the goals of these techniques are to increase movement and function of the spine, which will help to decrease the muscular tension and ultimately decrease headache. Other types of manual therapy that we do are applied to the soft tissue with the purpose of relieving tightness, relaxing muscles, again, improving movement and decreasing headache pain. So these techniques include passive stretching and massage. There are a lot of different types of massage techniques depending on the therapist might have their particular techniques that work for them, but effective with this patient population definitely is trigger point release. So this is shown in the second and third pictures. So this is again where you may have tight bands in the muscle. So we'll apply specific pressure to these bands to help increase blood flow and circulation to the area to help decrease pain. Other techniques that are used for trigger points are, say, trigger point dry needling, or techniques in which the therapist may use instruments applied to the muscle to loosen up the muscles. So there's a lot of different techniques that are used, and it just depends on the patient, how the patient presents, and what the therapist's level of expertise include. Okay, so in addition to the manual therapy, we will definitely include an exercise component. So we'll include postural exercise and correction. This will help take unnecessary stress off the head and neck to allow for a decrease in headache. So we'll talk about appropriate posture and give the patient strategies to help maintain this appropriate posture. So that's in the first picture. The second picture shows the patient doing a diaphragmatic breathing exercise, which is a basic exercise to help decrease the stress on the head and the neck. Different types of exercises on the right-hand side are performed to help decrease tension and stiffness. So that, for example, the upper right-hand side, the patient is performing an exercise in which he looks at a target. So he's supposed to look straight ahead and rotate his shoulders. So this will help decrease the tendency. Sometimes patients have a tendency to move like a stiff block. This will help decrease that. And then the picture below shows the patient doing an isometric exercise where resistance is applied without movement. So it's a very gentle exercise. Other standard exercises that are utilized with this patient population include the exercises you see here, which are called craniocervical flexion exercises. And those are the ones that help strengthen the little muscles that actually attach directly to the cervical spine, which have been shown to be weak with patients with cervicogenic headaches. So the patients are simply performing like a gentle chin nod or gentle chin nod with biofeedback as pictured in the second picture. And then also a patient can do the same exercise standing up, depending on the patient's progression and what the therapist wants to achieve with the exercise. So in addition to those basic exercises, we want to strengthen other body parts that might be weak in the head and the upper shoulders. But not only the head and upper shoulders, but even down to the upper back, the lower back, and the abdominals have been shown to be weak with patients that have headaches. So again, it's important for the therapist to do a full comprehensive examination to determine the exact deficits so we can make sure we're providing a comprehensive treatment plan for the patient. And we definitely will address aerobic exercise. A lot of times when people have headache, they stop moving and they can become deconditioned. So not only do we want to improve general overall conditioning, but aerobic exercise has a lot of health benefits. So it can help improve overall mobility, increase function. It has been shown to decrease pain and include other health issues just outside the box, such as anxiety and depression as well. So as you can see, oh, and then one more thing, patient education, self-management. We're continually providing patient education to let the patient know what they can do to help themselves because it's a team effort. So we give patients homework to do so that they can do things constantly on their own, because we might see a patient just 1 time a week, 2 times a week, or 3 times a week, but they really have to be managing the symptoms on their own and being active in their rehab. Okay, so that's typically in a nutshell about cervicogenic headache, just a general overview. But what about other types of headaches? There are a ton of different types of headaches. So I just wanted to briefly touch on tension type headache, migraine headache, and headache due to temporomandibular disorders, which are issues with the TMJ joint, the jaw. So basically, and very briefly, tension type headache occurs in about 47% of the population, and patients have symptoms. They can have symptoms on both sides of their head. These patients usually have complaints of pressing or tightening headache pain of mild to moderate intensity. And these types of headaches don't get worse with normal or daily activity, which is different from migraine, which can get worse with daily activity. Typically with tension type headaches, patients don't have nausea or vomiting, but they may have sensitivity to light or sound, but typically not both. So these are things that we want to ask patients about because that can help differentiate between different types of headaches, which will help differentiate our treatment plan. But with tension type headaches, patients have associated musculoskeletal findings like the myofascial trigger points, like I talked about with the cervicogenic headache. These patients also have decreased neck flexor endurance. So again, we're looking at the muscles, and also postural abnormalities. So this is why tension type headache patients are appropriate for physical therapy, because we're going to do a lot of the things that we do for our cervicogenic type headaches. And then your migraine patients, so those are definitely different. Migraines are usually located on one side. They can be located on both sides too, but migraine patients have, their pain is more of like a pulsating quality of moderate to severe intensity, and often can include nausea, vomiting, sensitivity to light or sound, and it usually causes people to avoid activity. But with migraines, there have been associated musculoskeletal findings as well, such as neck pain, muscle tenderness, and again, these stubborn myofascial trigger points. So this is why physical therapy is appropriate for migraine patients that do have these musculoskeletal findings. So if we treat these findings, this can help dampen the intensity of the migraine. So a lot of times we say with migraine patients, we may not be able to resolve the pain, but we can help attack issues that will help decrease the intensity of the pain. Whereas a cervicogenic headache, we can say a cervicogenic headache with physical therapy, sometimes 100% of the symptoms can be resolved. And then lastly, with the TMD disorders, patients with these disorders can have headaches, and the headaches usually occur at the time of the TMJ disorder. So basically, if a patient has an issue with the jaw or the muscles around that area, that can cause their headache. So if the problem with the jaw or the muscles of the jaw get better, the headache will get better. So again, for all these different types of headaches, we can use physical therapy the same way that we use physical therapy with the cervicogenic headaches. So how do you know how to choose your physical therapist? Because not every physical therapist has the same training and knowledge. You want to make sure your physical therapist has advanced knowledge, experience, and skills to treat headache. So your physical therapist, or this physical therapist, might have credentials or training to include the following. So they might have a fellowship certification, a residency. They may be a board certified clinical specialist. They might have an orthopedic manual therapy certification, so certain initials after their name to designate that. They may have training in pain science education or certification in pain science. Or they may have completed training from various classes and seminars to signify expertise in this field. So you really want to make sure that you know who you're going to get this type of physical therapy. And then in addition to this information, I just listed some questions that you can use as a guideline if you interview physical therapists or places of physical therapy. So you can ask the physical therapist what would designate them as an expert in headache management. Again, what certifications or credentials do they have? What additional classes or coursework have they taken? What types of treatment do they utilize? So use this presentation as a guideline. Do they do the manual therapy? Do they do exercise? Usually if there's only one thing they do to treat this type of patient and one thing only, then that might not be the best treatment approach, because typically it's a comprehensive approach. So you want to make sure they're utilizing manual therapy and exercise. You can also ask the therapist, what are some examples of headache patients that you have treated, different types of cases, what have you done? And then also you can ask the physical therapist for references. Do they have patients that they've treated that would be willing to talk to you to tell you about their experience? We would have to ask the patient for their permission because of patient privacy. But you can get references from the physical therapist. So you do want to do your homework, interview the physical therapy location and the physical therapist. And then also you can even ask to meet the physical therapist and tour the facility. So we always love when we get to talk to patients on the phone, talk about what we do, and have the patients come into the facility to make sure it's a good fit. They can see the place, see what type of equipment we use, and just get the overall feel of the location. So in conclusion, physical therapy has successfully been used to treat these certain types of headaches. It includes comprehensive multiple interventions, like I mentioned, and then your treatment will be individualized and specific to you. So we do not use a cookie cutter approach. It's very specific to what you tell us your symptoms are and what we find in your physical therapy exam. And we're constantly reevaluating. So if we feel like you're not progressing like you should, we're consistently reevaluating and refining things that we're doing in the clinic to make sure that you're making progress. And again, the physical therapist will work closely with your doctor and the healthcare team. So we really like to collaborate with anybody that's on your healthcare team. If you have your physician, your if you go to a chiropractor or a dietitian, or you work with a yoga instructor, we really want to make sure we're all working together so that you get the best care. And so I really want to thank the National Headache Foundation for letting me do this presentation. And then if you don't know, the National Headache Foundation has a ton of material that you have access to help you get any type of information you need about your headache. So I guess we can open up for questions if anybody has questions based on this presentation.
I'll give them a couple of minutes to get their questions in, but I'll start off with one. So you mentioned earlier that this is primarily for cervicogenic headache, and there's migraine. There's differences in all these. What would you do to someone? What would you do with someone that comes in with migraine looking for physical therapy?
Yeah, so somebody that comes in with migraine, we would definitely still ask all the same questions, probably be more specific on other things such as, making sure they're eating, making sure they're sleeping well, asking them about all of those triggers that are not necessarily musculoskeletal in nature. I ask everybody usually about stress, what they're doing for stress if that aggravates their migraines. And then we would do a musculoskeletal exam. So I would still look at all the joints, because if you have stiffness in the upper cervical spine, that can contribute to migraine or exacerbate the symptoms of migraine. And we look at the same things like the cervical range of motion, how you move your head and your neck, all the muscles, test your strength. And yeah, so it would still be comprehensive. A lot of things we would do for cervicogenic, except maybe ask more questions that are outside of the box than versus musculoskeletal symptoms.
Great. And I think that this was a question last time you presented, and I think you added a little bit more this one with kind of what to look for in a physical therapist. Do you have any recommendations for where people can look, whether it's a website or another organization that maybe has a kind of a comprehensive list of physical therapists, and then from there they could go and navigate and find the ones that have the right qualifications?
Yes, they can look on the APTA.org. It's the American Physical Therapy Association. But they can also look at, it's FAAOMPT.org. So you can find a manual therapist on that site. But again, you even though a therapist does manual therapy, you would still want to ask if they do treat the headache population. And you can always contact me. You can contact me through Eric, or my email is on this presentation, but I have a lot of connections and contacts based on various organizations that I belong to, so I can always direct you in the right location. But sometimes it is hard to find somebody. So I would definitely start with the American Physical Therapy Association.
Great. Well, looks like we have a quiet audience right now, but I want to thank everyone for joining us. If you think of a question later, feel free to reach out to the National Headache Foundation. You can reach us at info@headache. Oh, we just got one. 1 second. Here's a question from Paul. It says, do you teach patients to use ICIS as a acupoint for occipital neuritis, cervicogenic tension type headaches?
I'm sorry, can you repeat that question?
Do you teach patients to use ICIS OCCIPUT for
Oh, yeah.
occipital, okay, for occipital neuritis, cervicogenic tension type headaches.
Yeah, I do. Not all the time. It really just depends. For the occipital headache, definitely they can use ice in that area. For cervicogenic headache, it really depends on how bad their pain is and what state they're in, if it's an acute state or if it's a chronic state. And also, it depends on, say, if they come to therapy and I do manual therapy and stretching, they're more mobile after that. So I usually recommend not to do ice after that because they are moving better. I will tell them after therapy, if they feel like their pain is moderate to severe, then they could put ice just to calm it down. So typically it really depends on the patient. For the occipital headaches, I do recommend ice just for as little as 5 minutes or so. But again, after I do the therapy, I don't usually recommend the ice unless they're really sore. Also, along those lines, some patients don't respond well to ice, they stiffen up. So again, patient preference would play a role with that.
Great. So it looks like no more questions. Well, if you think of one later, feel free to email the National Headache Foundation. And as I say that, one more question comes in. Let's get
Okay.
Can physical therapy help with trigeminal neuralgia symptoms that are part of migraine?
Yes. So again, it does depend on if the patient does have musculoskeletal deficits. And in that patient population, I found those patients do have trigger points. People, because of the pain they're experiencing, say, for example, tend to hunch over more and be more in not so great postures. So even working on posture, alleviating the tightness of the head and neck can help dampen those symptoms. But say,
go ahead, sorry.
Oh, I was going to say,
go ahead.
If we do have a patient with any type of headache and they do not have musculoskeletal symptoms, then they would not be appropriate for physical therapy.
Great. And then can you give your email address in case anyone wants to contact you?
Yes.
I know it's at the beginning of the presentation in case anyone missed it.
It's, I'll give you a shorter email address. It's my first name, DENISEPTATC @comcast.net. So I really encourage anybody, I love this to talk about this. I will answer any question you may have. And if I don't know the answer, point you in the right direction. If you have any type of case, you, friend, family member, have any questions, I'd be happy to help.
Yeah, and if you missed that or you have any other questions, feel free to reach out to the National Headache Foundation. You could reach us at headaches.org, or you can send us an email at info@headaches.org. So I want to thank everyone for joining us tonight. Denise, thank you very much. It was a very interesting presentation. Hopefully everyone gathered some new information from it. And thanks again for joining us.
Thank you.